In modules 1 and 2, we are going to be focusing on ergonomics. And the purpose of this is that we need to understand the correct positioning techniques so that we can prevent discomfort and injury. It also helps us to see a clear view of the tooth that we are working on, and it also allows us easy access to the teeth during instrumentation so that we can help facilitate a more efficient way of treating the patient. The learning objectives for these modules is going to really focus around the ergonomics, the do's and don'ts for the seated posture. We're going to understand the application of the ergonomics and principles of the seated posture, the application of ergonomics and principles of positioning the patient. How are we going to position the overlight head as well as the instrument tray? How are we going to adjust the patient to facilitate the clinician posture? How we're going to work with the equipment and also understand our clock positions for instrumentation, and then understanding the positioning for the right-handed and the left-handed clinician. Why do we care about ergonomics? Well, it's because it's an applied science. It has been researched, and we're concerned with this because we want to be able to have the proper fit between the people and the tools that we need in the environment that we are working in to be successful. It focuses on making our tasks more comfortable and more efficient so that we can be more efficient clinicians to better fit the needs for ourselves to be able to be a better clinician for our patients. Poor ergonomics, which happens in every workforce, right? I mean, we all have ergonomic issues. I mean, who hasn't slouched? Who hasn't shrugged their shoulders? Who hasn't crossed their legs or their ankles? All of that can be poor ergonomics. So when we think about this, we can really suffer in our body if we are not ergonomically more aware and more mindful of how we are sitting and how we are doing tasks. For the dental hygienist, the work environment does include the dental office layout, the equipment, and the instruments. And we're exposed to these risks of these ergonomic conditions because it can lead to discomfort, to pain, and the possibility of disability. So in order to understand what ergonomics is all about, we need to understand that there are musculoskeletal disorders. And these are conditions where parts of the system, such as the muscles, the tendons, and the nerves, become injured over time. It's when too much stress is exerted on the body over time, and it results in discomfort or pain. It can occur when the body part is overused repeatedly with constraints of stress can cause that damage as well. And we're at high risk because we are doing repetitive motions and we're combining these repetitive motions with forceful movements. And so we need to find a way to prevent awkward postures so that we have a sufficient amount of time to be able to recover. When we talk about forceful or awkward movements, it does happen as a clinician of a dental hygienist. Periodontal instrumentation does involve forceful movements combined with awkward postures depending on how we are working around the patient. Not every patient is going to be ideal. So there's going to be times where we might have to, contort or pivot ourselves in different positions to be able to access a particular area in the mouth. So with that, injuries can occur overuse of these small muscles and these tight grips. So injury of this, the mucoskeletal system can cause loss of strength or impaired motor control, tingling, numbness, or pain. And definitely twisting of the torso or uneven shoulders for an extended period of time can increase injury. So the human body was not designed to make the same movement hour after hour, day after day, nor is it used to making required, repetitive motions of our arms and hands in a fixed position. So we're going to be learning some of the conditions that can occur, and we're going to be learning what we can do to help prevent them. So what do we do? The overall thought process is that we want to stay ergonomically in a neutral position. This creates the ideal ergonomic position where all of the joints are being used near the middle of the full range of motion. When we're further away from the posture, it puts more strain on the joints. And that's hard, you know. I mean, we move our body in ways that we don't even think about it. It's so effortlessly, right? It's just so second nature. And when we're learning a new technique, we really have to be more mindful on our movements and our space around us. So we don't want to alter our position just to get the job done, okay? And we're going to learn that where we have to do our job, but our patient has a job to do as well. Our patient is going to help us be the most effective clinician that they deserve. So we can't, we're going to do the best that we can to assume a neutral, balanced position. And we're going to make adjustments to the patient's chair and the equipment, but we're also going to ask the patient to step in and help out. So there's a couple of syndromes that we do need to be aware of. So we have the thoracic outlet syndrome, and this is a painful disorder when it affects the fingers, the hands, or the wrists, and it's caused by the compression of the brachial nerve plexus and the vessels. So take a look at the picture to the right. You can kind of see that brachial nerve plexus is right in that neck area. And this happens from tilting your head forward, hunching your shoulders, or just continuously reaching overhead. This is important when this is really going to help, when you get your loops, because we want that head to tilt only about 15 degrees. And we don't want to overextend that because that can really put a lot of pressure on that thoracic, in that thoracic outlet. The other thing that we want to be aware of is making sure that our equipment is in an arm's reach. We don't want to be consistently reaching to grab things. We can reach for things, but we just don't want to overstretch. And some of the symptoms can be numbness and tingling, pain in the fingers, hands, or the wrist. The rotator cuff tendonitis. Now take a look at this word, tendonitis, itis, I-T-I-S. That means inflammation. So this is inflammation of the tendon within the rotator cuff near the clavicle in the shoulder region. This is a painful inflammation of the muscle tendons in the shoulder region, and it's caused by holding your elbow above your waist. Okay, again, we don't want to be raising our elbows up too high. We call that chicken wings. We want to be able to keep them kind of lower at our wrist, but we don't want to be like hugging our body either. There needs to be like this natural movement, or it can happen from holding our arms away from our body. Symptoms that can occur is severe pain or impaired function of the shoulder. You have the pronator syndrome. This is a disorder of the wrist and hand caused by the compression of the median nerve by the pronator muscle. So take a look at this picture. Now this syndrome is very similar to carpal tunnel. If you look at the median nerve, it goes right kind of in that forearm, it branches off to the thumb, and it branches off to the index finger, the middle finger, and the ring finger, okay? This type of syndrome really does starts to happen when we're holding our lower arm away from our torso of the body. And things that can happen is some numbness, some pain, tingling in the thumb, the index finger, the middle finger, or even the ring finger. The extensor wad strain, this one is a painful disorder of the fingers as a result of injury to those muscles. If you look at the picture, the muscles are on the lateral side of the arm, going up the forearm, and it extends into the back of the hand. This happens when we are extending the fingers independently from each other. This particular strain is commonly found in hygienists when we do not have a proper pen grasp on how we're holding our instrument. And in the next coming weeks, you're going to learn how to use your instrument and hold your instrument, which is going to be different for you. And so we're going to be utilizing tiny little muscles that we've never really used in the way that we're using them. And so we have to be mindful on how we're holding our instrument to prevent this from happening. Some symptoms that can happen is numbness of the pain, or loss of strength in the fingers. Carpal tunnel syndrome, like I said before, is very similar to the pronatal syndrome. This is also a disorder that involves the median nerve. However, this nerve now is being compressed by the carpal tunnel, bones. So once that is being compressed from the carpal tunnel bones. So the cause of this is repetitively bending the hand up and down or side to side at the wrist. This also can happen from pinching an instrument without resting the muscles. When we start learning how to do calculus removal, this is going to become something we need to be very aware of, because we can't be in a constant state of pushing a lot of pressure on our instruments to remove calculus, because over time it's going to really compress down on that median nerve. Some of the symptoms with this would be numbness and pain, a tingling of the thumb, the forefinger, and then the middle finger and the ring finger. Ulnar nerve entrapment. This one is a painful disorder of the lower arm and wrist. This is caused by the compression of the ulnar nerve at the wrist. Take a look at the picture. We've got this nerve going up to the pinky and a little bit into that ring finger. Now, this one is very important for us as hygienists as well, because again, as we get into understanding how to hold our instruments, our pinky tends to want to go off on its own, and you'll see that. And we just have to be mindful and bring our pinky back into that relaxed state so we can prevent this condition from happening. It does happen from bending your hand up and down or side to side at the wrist, or holding your little finger out and spanning it away from the hand. Sometimes we call this drinking tea, where all of our fingers are where we wanted to, but for whatever reason, our pinky stands straight up and it's like we're drinking tea. Symptoms to this would be numbness, tingling, or loss of strength in the lower arm or wrist. Then we have tenosynovitis, which is a painful inflammation of the tendons on the side of the wrist at the base of the thumb. Okay, so take a look at this picture. Right at that base of that thumb, there is this synovial sheath. And that synovial sheath is what protects the ligaments and the tendons. And that area becomes very inflamed. And this happens from hand twisting, forceful gripping, or bending the hand or to the side. This will cause pain at the side of the wrist or at the base of the thumb. I've seen this happen before. I see this very common in clinicians who have, like, if they are crafters, if they are doing a lot of like knitting or crocheting, we do see this happening. But if it does, what we do is, again, itis, you can see that itis, inflammation. Anytime you see that, one of the remedies that we like to really go towards is cold therapy. Last but not least, we have tendonitis. I'm sure everybody has heard about tendonitis, inflammation of the tendons. So this is painful inflammation of the tendons of the wrist resulting from a strain. It's caused by repetitively extending the hand up and down at the wrist. Okay. And symptoms, pain at the wrist or the outer edges of the hand. Okay. The foundational skills for periodontal instrumentation is a complex psychomotor skill. This is completely teachable, but it takes time, and you have to give yourself some grace. It requires proper positioning and you need to understand the proper instrument grasp, how to use your mouth mirror. We're going to teach you those finger rests. We're going to teach you how to use proper strokes around the teeth. And it takes time because each individual will learn this skill, but these skills need to be mastered one by one. And so over the next couple of weeks, we're going to be teaching you how to have the proper positioning and the pen grasp, because if you can grab those two things, the rest of the psychomotor skills, it's like building blocks, one after another. And we just continue to strengthen the skill. And the strengthening of the skill takes time because we're using our fingers in a manner in which we've never used them before. So, how we never thought, we don't think twice about how we hold our pen. But imagine how difficult that was when we first tried to learn how to write. Now we're kind of doing that all over again. We're going to learn how to hold an instrument in our hand, and instead of writing, we're going to be cleaning teeth. So here comes the ergonomics, okay? So for the head and neck position, the goal is we want to tilt it from 0 to 15 degrees. This is going to help with your loops. Your loops are really going to help you, keep that into that 0 to 15 degrees. We tend to tip our head too far forward, or we tend to tilt our head to the side if we can't see, right? That makes sense. If we're moving our body, we're doing it for a reason. So this is where that mindfulness needs to come in. If you find yourself tipping your head too forward, or you find yourself tilting your head to one side, you have to ask yourself, why am I doing this? And this is where your patient comes into place. Your patient needs to do a job. So when you are working on the maxillary arch, your patient should be tilting their head up. If you're working on the lower, your patient should be tilting their head down. If you are working on surfaces towards, you should have your patient turn away from you a little bit. If you are working on surfaces away, you should have your patient turn their head towards you. And this allows you to have better visualization to be able to see what you need to see. For your back, we want to make sure that we're leaning at the hips or the waist, okay? And no twisting, all right? We want to be able to use our chair for that. So if you need to move in a different position, make sure that you're using your feet to be able to move so you're not twisting the torso. If you find yourself leaning or twisting or hunching, again, be mindful of it. Why are you doing it? If you understand the why, we can correct it. Your torso should be in line of the long axis. It should be perpendicular to the floor. We shouldn't be off to one side. We shouldn't be leaning. We shouldn't be twisting. Again, being mindful of that. Shoulders should be even, okay? Our shoulders should not be hunched, meaning that we move our shoulders up to our ears, okay? When we move our shoulders up to our ears, do that a couple of times right now, okay? When you do that, yes, I'm doing it right now too. When you're doing it, that puts a lot of stress on your upper shoulders and even on your lower neck, okay? So make sure that your shoulders are even and they're just nice and relaxed. Your upper arm. Okay, so with your arms, there needs to be a little bit of movement, okay, about 20 degrees. We don't want to lift our arms higher than our waist because then we call it chicken wings. I think I said that earlier. We don't want chicken wings. We want to have a little bit of that movement and we don't want to be hugging our body, okay? We're going to be naturally moving around the patient's body. And so we have to have a little bit of movement in order for us to, to stay in that neutral position. For our forearms, our goal is to keep our forearms parallel to the floor. We want to avoid being, the angles between, we want the forearm and the upper arm to be less than 60 degrees. Anything more than 60 degrees means that we're coming up a little bit too high. And when we're doing that, that can put a lot of stress on that, on the median nerve. But, if you think about it, when we're lifting our arms a little too high, that's also going to put a little bit more stress, in areas that we don't want. And our hand position, probably one of the most important, right? Hands are our money makers, right? So we need to keep our hands healthy, okay? So when we talk about the neutral position of the hand, the little finger side of the palm is slightly lower than the thumb side of the palm, okay? Now this will make more sense when we start getting into instrumentation. When we start doing some instrumentation, the palm is going to be facing the arch that you're going to be working on. So if you are working on the maxillary arch, your palm is going to be facing the maxillary arch. If you are working on the mandibular arch, your palm of your hand is going to be facing the mandibular arch. So just know that you don't want the palm completely parallel to the floor. All right, we talked about this in lab. The chair, okay? With the chair, you want to position your buttocks all the way back to the chair and you want to adjust the seat so that your feet are flat on the floor, okay? We can't keep our feet up on, the wheel holsters. We can't cross our legs, cross our ankles. We can't tiptoe with our, toes on the floor and our heels up. Needs to be flat on the floor. We need to support that lower back, okay? We want to be able to have that our weight is evenly distributed within our hips. And we want to have like our seat just about an inch higher than the front of our seat. And that allows our hips to be a little higher than our knees, okay? And then, we want to move the seat pan of our backrest so it nestles in our lower back. So we just, like I said before, we want to like a little bit of a hug on that lower lumbar area of our back. Make sure that your shoulders, again, are nice and relaxed, down and back. Shoulder and arms are parallel to the long axis of the torso, which is perpendicular to the floor. And we want the elbows to be near our body. We don't want to hug our body, and we don't want to raise them higher than the waist. So now that we talked about how we as the clinician need to be, we are now going to focus on our patient. So there's this mantra that we talk about. Me, my patient, my equipment, my non-dominant hand, and my dominant hand. Okay? We just went through me. Now we're going to go to my patient. So when you are working on your patient, when we're working on the maxillary arch, we're going to be working on we're going to have the patient in the supine position. Now take a look at the picture on the lower left. Take a look at the back of the like the back of the patient's chair. It's almost parallel to the floor. The patient's feet are also just either even or slightly higher than the patient's nose. The chair, again, like I said, is parallel to the floor for the maxillary areas, and we want the patient to tilt their chin up, okay? And then we're going to take the dental light, we're going to put it over the patient's chest, and we're going to tilt it to the maxillary arch. So again, maxillary arch, we want the patient in the supine position. The feet of the patient is going to be slightly higher than the nose, and the back of the chair is going to be parallel to the floor. Chin up for the patient, light over the chest, tilted towards the upper arch, arm's length away. For the mandibular arch, man down, lower arch. This is semi-supine position. Now, the only difference between the semi-supine position and the supine position is that the semi-supine position, we're just going to slightly raise the back of the chair. Not much, okay? Just bring that back of that chair just slightly up. Have the patient rotate their chin down, and then the light is going to go right over the mandibular arch, perpendicular right over that arch. So again, the mandibular arch, we're going to do a semi-supine position. That chair is going to be slightly raised. Patient is going to turn their chin down, and we're going to put that light perpendicular over the patient's lower jaw. Okay, now equipment. Your dental light will always be an arm's length away. And the reason for that is because if it's too low and then you move your head, you're going to bump your head. We don't want that, okay? So also with buns and stuff, we want to be able to make sure that there's enough room for our head to move around the patient. Your tray needs to be within reach, okay? It can either be in front of you or it can be on the side of you. It's never in front of the patient, like over the patient, and it's never going to be on the opposite side of the patient. So you need to make sure that your tray is within your arm's length. Okay, let's take a look at this position. This clinician, her arms are parallel, her torso is perpendicular to the floor, her arms aren't raised, her shoulders are nice and relaxed. This is a great position. So this position is correct. Now take a look at this. There are so many things wrong with this picture. Both of them. Okay, elbows are raised. Patient looks like she's stressed. I mean, she's using extra force, extra muscles to get her arms up there. That's the chicken wings I'm talking about. Okay, the patient's chair is too high. We do not want your legs going under the patient's head. The patient positioning for the clinician, again, too high. Look at her feet. Her feet are on top of those casters, those wheel casters. Okay, feet need to be flat on the floor. And you can kind of see that she's hunching a little bit. So her shoulders are not in a relaxed state. So this is not a good position for a clinician. So let's talk about the neutral position. Okay, we did this a little bit in lab. You want to sit alongside your patient and you can position your arm against your side. Position your arm across your waist and you're going to lower the patient's chair until the patient's opened mouth is below the point of your elbow. That's a really good visualization that you can do to see how far your patient is down. You want to make sure that your shoulders are not raised up or towards your ears, okay? This allows us to have an arm's length away from our patient. That's what we're looking for. If we're not about an arm's length away, then that's when we start to hunch or kind of put ourselves into positions that we don't want. So we want that natural, space around us. So let's talk about the clinician position in relation to the treatment area. Okay, clock positions. Loves and hates, right? Everybody loves clock positions, but then yet everybody hates clock positions. But clock positions help us during instrumentation. It helps the clinician to move around the patient to maintain a neutral position. So when we think about the clock positions, we have to think about an analog clock, all right? So when you look at the clock, the head of the patient is always at noon. The feet of the patient are always at 6. Now, depending on whether you are a right-handed or a left-handed clinician depends on where you're going to sit around the patient. If you are a right-handed clinician, you are going to work on the right side of the face. If you are a left-handed clinician, you're going to work on the left side of your face, So the right-handed clinicians, your clock positions will range between 8 and 1. And the left-handed clinicians, your clock positions will range between 11 and 4. So let's talk about the right-handed clinician. The right-handed clinician is going to range between 8 and 1 o'clock. Your 8 o'clock position for your patient, you are going to be facing the patient, which means both knees are going to face the top of the patient's head. Legs do not go under the headrest, and we do not cross them. So take a look at the clock, take a look at the picture. This is going to be your 8 o'clock. Let's go to your 9 o'clock. Your 9 o'clock, you are going to be on the side of your patient. You can either straddle your patient or you can move both legs like you were in an 8 o'clock position, but you're just going to back up a little bit. No, sorry, you're going to move up a little bit. You're going to be more closer to the patient's ear. Again, your legs do not cross underneath the headrest or the chair. Here's your 10 and 11 o'clock. You're going to be sitting at the corner of the headrest and you're going to be looking directly at the patient's eyebrow or eye. Look at the analog clock. You're going to be right there in the corner of that eye. And then we have noon. This is right behind the patient's head. And then here is your 1 to 2 o'clock. If you do the 1 to 2 o'clock, you're going to be facing and looking at the patient's left side of their eyebrow. Let's talk about the left-handed clinician. Your clock positions, you will sit between 11 and 4 o'clock. This is the 4 o'clock position for the left-handed clinician. You can see that both legs are facing the top of the patient's head. If you take a look at the clock, you can kind of see that you're in that 4 o'clock position. This is you facing the patient. This is going to be the 3 o'clock. You are going to be facing the patient. Now, there are 2 ways you can do this position. You can either straddle your patient, or if that is uncomfortable for you, or if that is more difficult for you, you can put your knees in that 4 o'clock position, but you're just going to scoot your chair up just a little bit closer to the patient. Either position with your legs is acceptable for the 3 o'clock position. This is going to be the 1 to 2 o'clock position. This is going to be at the corner of the headrest and you'll be facing the patient's eyebrow. Again, legs do not go under the headrest. Again, very easy, right behind the patient's head is noon. And for the left-handed clinician, if you were to sit on a little bit on the right side of the patient's head, you can go to that 10 and 11 o'clock at the corner of the headrest, and you would be looking at the right side of the eye. Are you just so excited that now you know the clock positions for the right-handed and left-handed clinician? Now we get to understand why these clock positions are so important, because now we're going to start to understand surfaces towards and surfaces away. Okay, we learned in lab how we separate the mouth into sextants. So the upper right, number 1 through 5 is sextant 1. Sextant 2 is number 6 through number 11. Sextant 3 is tooth number 12 through 16. We're going to drop down to the lower left. Sextant 4 is 17 to 21. Sextant 5 is tooth number 22 to 27. And then sextant 6 is 28 to 32. So when we're working on the anterior teeth, that's going to be sextant 2 and sextant 5. If you look at that picture, those are the teeth that are shaded in blue. Okay? So when we're dealing with the surfaces towards and away, we separate the tooth in half. We're going to make a vertical line down the middle of those 6 teeth on top and those 6 teeth on bottom. Okay, so when we have that vertical line down the middle, we shade in, look at the picture, we shaded in the right side of every tooth. The shaded areas that are in yellow that you also shaded on your typodont are surfaces towards you, because those surfaces are closest to you, because it's the right side of the tooth and you're a right-handed clinician. Surfaces towards in the anterior sextant, you are going to sit at 8 or 9 o'clock. You get to choose. Okay, so take a look at that picture, get your typodont out, and those surfaces that are shaded are your surfaces towards you, because you're a right-handed clinician, and those are the right side of the tooth if we divide it in half. And your clock position is 8 or 9. Now, your surfaces away in this picture they're shaded purple. On your typodont, we did not shade these in. These are the surfaces further away from you. Okay, so it's the left side of the tooth. So these surfaces are further away from you, so these surfaces are considered surfaces away. These surfaces, you're going to sit at noon. Now I know it says 11 to 1 because there is a little bit of wiggle room. Okay, so technically you can sit between 11 and 1, but right in that noon part is where you're going to want to sit. Okay, so on your typodont, these surfaces are not shaded. Okay, it's the left side of the tooth. So these surfaces are considered surfaces away from you, and you're going to sit around in that noon o'clock position. For the left-handed clinician, okay, so for the left-handed clinician, you have that vertical line down the middle of the tooth. We shaded these on your typodont. They're also shaded in this picture. We draw that line down the middle of the tooth, and everything that's shaded is the left side of the tooth. The left side of the tooth is the surface that's towards you because you're the left-handed clinician, okay? So the left side of the tooth is going to be the surfaces towards you. At this, your clock position can be either 3 or 4 o'clock, whatever you seem to feel most comfortable with. But again, if you look at your typodont, what's shaded on your typodont and what's shaded here is that left portion of the tooth is that left side, which is closest to you, and you're going to sit at that 3 or 4 o'clock position. Now, for your surfaces away, on your typodont, we did not shade that in. On this picture, you can see that it is shaded in purple. These surfaces are the right side of the tooth, which is away from you. It's further away from you, so that those surfaces are further away from you. This clock position is going to be at that noon. Okay, I know it says 11 to 1. There's a little bit of wiggle room, but we want to be behind the patient's head. Okay, so remember when you're looking at your typodont that the surfaces that are not shaded are your surfaces away because it is the right side of the tooth. So we have to remember of that imaginary line going down the center of the tooth. Okay, now that we understand anterior teeth, we have to talk about the posterior teeth. Okay, so the posterior teeth, there's going to be sextant 1, which is the upper right, sextant 3, the upper left, sextant 4, the lower left, and sextant 6, which is the lower right. Now, in order to understand this, the surfaces towards and away for posterior teeth, you have to know that the cheek side of the teeth is considered the buccal aspect, okay? In the front, it's called facial. So if it's touching the cheeks or the lips, that side of the tooth is known as facial for anterior, buccal for posterior. Inside, where your tongue touches, is known as the lingual, okay? It's the lingual for posterior and anterior, but it's all the lingual. If your tongue touches it on the inside, that's considered lingual. For the right-handed clinician, let's talk about surfaces towards and surfaces away in the posterior. For the right-handed clinician, surfaces towards. The clock position is going to be at 9 o'clock. Now remember, you can either straddle the patient or you can put both knees towards the patient's head, and you're just going to scoot up a little bit closer to the patient. Now look at the picture all the way to the right. You're going to see that the surfaces that are shaded are the surfaces towards. So you have sextant 1 buccal and sextant 6 buccal. Then you have sextant 3 lingual and you have sextant 4 lingual. These are the surfaces towards you because you're a right-handed clinician, meaning that you can see these surfaces with direct vision. Now, the one thing to remember is when you are working on surfaces towards, sometimes they're a little too close to you. So you're going to ask your patient to turn their head a little bit away from you, as you can see depicted in this picture. That may be what you need to do to be able to see these surfaces, because sometimes if they're too close, you can't see them. But you have the patient move their head a little bit away from you. Now you can see these surfaces towards really nicely. 4 surfaces away. These are surfaces that you will probably need your mouth mirror to use indirect vision for because these surfaces are further away from you. You're going to be sitting at that 10 and 11 o'clock position. And as you can see in the picture, what's shaded, now we have sextant 1 lingual and sextant 6 lingual. And we have the sextant 3 buccal and the sextant 4 buccal. These surfaces are further away from you because you're a right-handed clinician. Now, since the surfaces are further away from you, you might have to have your patient tilt their head a little bit towards you to be able to see these surfaces. Now for the left-handed clinician. For the left-handed clinician, your surfaces towards is going to be sitting at 3 o'clock. You can also, remember, you can either straddle or you can put your knees towards the patient's top of their head. Now note the surfaces that are shaded. You have sextant 1 lingual, sextant 6 lingual, sextant 3 buccal, and sextant 4 buccal. These surfaces are closest to you because you're a left-handed clinician. Now sometimes the surfaces towards can be a little too close. So if you're unable to see very well, you're going to have you turn your patient's head a little bit away from you as depicted in the picture. And surfaces away. So for the left-handed clinician, you're away, you're going to be sitting at that 1 to 2 aspect. Now, most likely you are going to have to be able to use your mouth mirror to be able to see these because these are surfaces furthest away from you. So take a look at the shaded areas. Number sextant 1 buccal, sextant 6 buccal, sextant 3 lingual, and sextant 4 lingual. These are the surfaces furthest away from you. And you're going to sit at that 1 to 2 position.